Hi, I'm Jay Nicholson.
And I'm Morgan Fife.
And we are Bellarmine University physical therapy students here to talk about Lyme disease today. So Lyme disease is an infection transmitted from black-legged and deer ticks to humans through tick bites. With medical treatment and a quick diagnosis of Lyme disease, most symptoms can be treated medically with a course of oral antibiotics.
Lyme disease is most prevalent in the upper Midwest and northeastern United States, Asia, and parts of Europe. There are reported 300,000 cases in the U.S. right now. The most common symptoms of Lyme disease are a bullseye rash located at the location of the bite, also called erythema migrans, fatigue, and joint pain and stiffness. Although the bullseye rash is the most common symptom, less than 50% of people with Lyme disease report having the rash, and less than 50% of people diagnosed with Lyme disease report being bitten by a tick.
The acute phase of Lyme disease is treated with antibiotics, but if not caught at the beginning, signs and symptoms and the infection can become dormant and reside in the body for an extended period of time. At this time, we consider this chronic Lyme disease, and this is most likely when PT becomes involved in the treatment of Lyme disease. The most common symptoms of chronic Lyme disease are disabling fatigue, severe headaches, diffuse joint pain, and swelling.
It is important for PTs to educate patients on the signs and symptoms of Lyme disease, as well as the chronic Lyme disease signs and symptoms. We will be responsible for guiding patients to maintain or achieve their level of health and wellness to avoid exacerbations of symptoms, and as in all other cases, treatment of Lyme disease and chronic Lyme disease will be patient-centered and based on what their current signs and symptoms and complaints of the patients may be.
Physical therapists will be most involved in playing a role in pain relief and improving the movement of joints through stretching and range of motion exercises. Also, working with the patient to develop a home exercise program and regimen to address fatigue and daily planning of activities. Treatment will include strengthening exercises that consist of light resistance with low loads and high repetitions to improve the patient's general conditioning level. We can include interventions like massage, myofascial releases, ultrasound, moist heat, and paraffin for pain relief, and suboccipital releases for headaches caused by chronic Lyme disease. So thank you for listening.